Hello and welcome to Sign Out Presentations. In this episode, we are looking at how to perform primary survey and CPR during this COVID-19. When it comes to primary survey, it is very important to check danger. First, is it safe for me to approach the patient? And then, is it safe for my bystanders if there's anyone around? And then, is my patient safe there? And then, especially during this COVID-19, it is important to check, have I got the PPE that I need? For example, gloves or mask. Once we know it's safe to approach the patient, next is to check response of our patient. First, we check, is my patient alert? If not, can my patient respond to any command? If they can't respond to any command like open your eyes, then we move on to check response for pain, which is just above the collarbone, you pinch the muscles. If they don't respond to that pain that we gave, we decide our patient is unresponsive. If your patient is unresponsive and you are alone, it is very important to get help, sharper help, or if you have got a mobile phone, dial 999 and put it on loudspeaker and then carry on assessing your patient. As the patient is unresponsive, now our main concern is their airway and breathing. During this pandemic COVID-19, it is not recommended to put your ear close to the patient's nose and mouth to check breathing. Resuscitation Council UK recommends only to look for obvious signs of normal breathing, which means you will be looking for normal chest rise and fall to confirm breathing. If you hear noisy breathing or not normal breathing, or if you're not sure of whether this is normal breathing or not normal breathing, treat it as not breathing. As a first aider, if a patient is not breathing normally or not breathing at all, you should straight start CPR. But if you are trying to check a carotid pulse, by all means, you can check carotid pulse. If you have someone to help you, ask them to call 999 and give them the information. Or if you're alone and then you have not called the ambulance yet, this is the right time to call 999 and put your phone on loudspeaker while you continue your treatment to your patient, which will be performing CPR on the patient. During this COVID-19, it is recommended to cover the patient's nose and mouth using a piece of cloth or a towel before you start CPR. And then start chest compressions at the rate of 100 to 120 compressions per minute and 5 to 6 centimeters depth. During this COVID-19, it is not recommended to give mouth-to-mouth rescue breaths using pocket mask or even face shield. Just continue with chest compressions. Continue chest compressions until help arrives. If you have access to defibrillator, use it soon as possible.